already registered center in our district. It has opened a digital narrow tracking center where it has got around 10 lines of toll-free number. So with that 10 lines, it has got a database of around 17 lakh population who are living in Kolar district. Actually, Digital Nerve Center started with an innovative idea of enrolling all the public who are living in Kolar and making a database of their health conditions and providing them good services. Mainly, they are concentrating on NCDs, that is non-communicable diseases, then mother and child care services, immunization services, and other related healthcare services. So they got around 25 staff who are working in their center. They're all well trained, and it acts like a call center. They provide virtual consultation also for the needy patients. Actually, how it works means, from a rural place, a person can call directly to the Digital Nerve Center. They can fix up an appointment with the Digital Nerve Center with the help of Digital Nerve Center for a specialist who is working in a district hospital. So they can have a virtual consultation. They can narrate their problems to the specialist. They can get the treatment there also from there. So this is the mechanism in which they are working. So with the help of them, we started our COVID war room. The objective, the main aim of the COVID war room is to control the COVID-19 pandemic and to reduce the public suffering and to implement smooth implementation of the COVID-19 protocols all over the district and to create awareness among the public in the Kolar district. So objectives were to do the contact tracing, to monitor quarantine watch activities, to provide IEC activities throughout the district and provide a proper counseling, to monitor home isolations, bed management for the COVID-19 patients, then tracking of all the patients and providing the services. We established a grievance redressal mechanism also through the COVID war room, and we are monitoring COVID also, that is vaccination of the COVID. So the goal of this war room is to management of COVID-19 pandemic all over the district and to avoid suffering of the people from the consequences of COVID-19. It may be related to disease only, or it may be related to other social causes. It may be related to all other untoward effects of the COVID-19 pandemic. So in Kolar district, it's having a digital nerve center, which is established by the Tata Medical Diagnostics. And it has various innovative methods like virtual consultancy, booking of the prior appointments with the specialists, counseling services for the pregnant woman, NCD, and also with the mental health illness, etc. It has a well-trained staff who can provide good quality of services to the people of Kolar. They have a 24/7 helpline with 10 active lines. So it has a venture, it's a venture between district administration and Tata Diagnostics. The helpline was started to fight against the emergencies of the COVID-19 in the Kolar district. It was inaugurated by our deputy collector. So the services which are provided in confined to COVID-19 were the issues related to HMR portal entries, then patient tracking and profiling, home isolation monitoring, bed management activities, regular follow-up and care of those who are suffering from COVID-19, escalation and resolutions, then counseling services and grievance redressal mechanisms. These were the services which provided from the COVID-19 war room. So the ongoing activities are patient tracing and profiling. Here, each and every patient who are entered through RT-PCR, who are detected positive in the RT-PCR app or entered to the or directed by the ICMR portal. And from the ICMR portal, we are selecting all the positive patients, and uh, depending on their patient details, and we confirm their isolation facilities. Like they may be isolated from in a home isolation, or maybe in CCC, or maybe in DCH, that is designated COVID hospital, or designated COVID healthcare center. So even the approval of these cases, cancellation and transferring of these patients between the districts and between the states, and the needs of the patients are addressed according to their location as per their requirements. Home isolation monitoring. Here, each identified positive patients who require continuous continuum are called regularly through the, and we used to provide counseling on dietary, hygiene, then precautionary measures they have to take. Home adequacy was checked through the phone. Then health protocols were shared with the home isolated patients. Even we provided virtual consultations for them through virtual platforms like WhatsApp calls, WhatsApp video calls, and all. Then bed management activities. Here, the warriors on daily basis trace all the patients as per their needs and allot the beds within the district and monitor escalation of patients from field up to the level of ICU and ventilators. Here, all the patients were called daily, and their oxygen saturation levels were checked. Their vitals were checked, were inquired through phone consultation. And if any patient having saturation less than 94 were directed for the medical triaging. The triaging used to happen at the taluk level hospitals. At the taluk level hospitals also, we have our teams who are specially kept for triaging activities. These medical teams used to check their vitals, and they used to decide whether they have to be shifted to the ICU ventilator or for the oxygenation beds and something like that. So all the bed availability, then from the level of CCC up to the level of DCH were shared with these teams. So they used to allot the beds for the needy patients. Then grievance redressal mechanism. It has War has received many grievance calls also. It used to receive many grievance calls also.
Sorry for interruption. So you have 3 minutes left. I request you please conclude.
Yeah. The grievance redressal services regarding testing, treating, home isolation, quarantine, with the help of concerned officials of the grievance redressal cell. And coordination counseling of the inter-district and the interstate travelers. We used to call the inter-district and interstate travelers through the who are enrolled in Arogya Setu app, and we used to call them, and we used to give the services regarding testing, their isolation statistics and dietary statistics. Everything was monitored. Then we are having war room IEC wing, where we used to do the counseling of all these patients regarding symptoms and all, and we used to educate the people regarding COVID-19 pandemic with respect to their symptoms, with respect to their status, and what they have to do, everything. Then quarantine system was also maintained at this level. So each and every patient who was under quarantine was monitored. We used to call them twice a weekly, and we used to look for the any quarantine breaches and all, and we used to educate them not to breach the quarantine. If at all any continuous quarantine breaches were happening with the patients, then we used to warn, and we used to book a case against them. Then ILI SARI care coordination. In Karnataka, we have Karnataka Private Medical Establishment Act, where all the private medical clinics are registered under KPME. So there was a KPME nodal officer. He used to monitor all these institutes. So whatever the cases ILI SARI patients registered in these private establishments, the list was shared with the Dinc, our COVID war room. From the COVID war room, used to call each and every patient, and we facilitate them for testing and other things. So this is again regarding how home isolation and care coordination. Then we have other country travelers were also tracked, and they were also given information about testing, treating, and everything. Suspected citizen tracking system was also there. Then we used to provide awareness regarding COVID-19 hygiene, and we trained the ASHAs virtually through the virtual platform. Then from the Aragya Setu also, we extracted the beneficiary list, and we used to call them, and we used to provide the services related to COVID-19. So these are all the, this is a progress report for the positive patients. We called around, the calls were made around 7,820. Then for home isolation was 6,320. So this is the total calls what we have done till today, and it's going on activity. So then this COVID war room was linked with the COVID war room when the vaccination started, and it was started from the 15th Jan 2021 also. The objectives of COVID war room was to facilitate vaccination program and to track and monitor areas, and to create awareness about importance of vaccination, and to give reminders to the next due date of vaccination. So we in first phase we vaccinated healthcare workers, frontline workers, and prioritized age group. So this is an ongoing activity, still it is going on. So here we used to do COVID reminders, that is reminders for the next dose of vaccination. As on today, the team has made more than 2,000 COVID reminder calls to the scheduled beneficiaries. Team is doing counseling calls for the vaccinated people and providing counseling for monitoring of areas also. These our honorable MP sir visited our war room. Then this is a testimonial, a case details which has happened, and how we solved it on. Thank you, everyone.
Thank you, Dr. Jagdish.
Thank you, sir.
This is the situation that you are telling. First, second wave, because second wave Karnataka is badly hit, very badly hit.
Yes,
and
sir.
I don't know what is the condition in the Kolar district as per se, but how are you on it?
Sir, the second wave is also very bad in Kolar, sir. We are getting around 4 to 500 cases per day, sir. So almost all the patients were tracked, and we are initiating strict isolation norms for those home isolation patients. And for the primary and secondary contacts also, we have done quarantine protocols. And for those, we have already opened our CCC centers at all the taluka levels. We have 6 blocks in our district, sir. All the 6 blocks were having at least 2 to 3 COVID care centers, where all these asymptomatic and healthy positive patients are placed for those who cannot be managed at the home isolation. And for the positive patients, we have integration of our private medical college over here, sir. They have provided around 600 beds. And district hospital is also having around 300 beds, which are especially kept for these positive patients, and we are managing the show, sir. Till today, there are no such issues.
What's the total number of active cases as on date?
Sir, 12,268, sir. As on date, sir. No, sir. Total positives are 12,000. As on date, we have around 900.
No, I'm asking.
Active cases,
active cases
as of now.
Active cases, I'm asking.
Yes, sir. As of now, we have around 1,200 cases, sir.
Only 1,200 cases.
Yes, sir.
400 per day.
Yes, sir. Almost 400 per day, sir.
And what is the positivity rate?
Sir, positivity rate is around 3.5%, sir.
3.5%. That's
yes, sir.
Very good compared to the rest of the national average, I would say.
Yes, sir.
That's okay. And I hope there are no people who are still looking for beds. in your district?
Sir, we are having one more medical college, sir, which is not yet started, and we have around 600 beds which can be utilized for these patients. We have recognized it as an CCC, and we are shifting all the patients to that centers who are in need of the minor treatment. The major cases are maintained in our district hospital and one medical college, Sri R.S. Jalapa Medical College, where we are getting a lot of beds and there are no issues, sir. We have established around 40 ICUs in our district hospital, 40 ventilators. And in the medical college, there are dedicated 30 ICU beds, 30 ventilator beds for these COVID positive patients. So till now, there are no such issues, sir. We are maintaining
What
it.
is
Sir.
the deaths per day? Number of deaths per day?
Sir, actually, the deaths not regularly it's happening, sir. Within last 1 week, we had around 10 deaths, sir. Occasionally 1 or 2 deaths per day, like that. Last in 10 days, around
So
last 1 week,
that
10
means
deaths. Sir.
your district is, that means Kolar district is comparatively well placed.
Yes, sir.
In terms
Yes,
of
sir. Yes, sir.
Rest of the state.
Yes, sir.
Okay, good. Thank you.
Thank you very much, sir.
Thank you. Dr. Madan Mohanji? Madan Mohanji?
Thank you. Thank you. Thank you. It is that everything looks very rosy,
Yes.
In Kolar district. So, I mean, if that is the case, we are happy to note that. But, all India, the scenario is very pathetic, as you may be knowing. Now, what is the positivity rate of in Karnataka state as such? Your is 3.5.
Sir, exactly state positivity rate, I don't know, sir, because I'm not the surveillance officer. I am the district TV officer who is looking after these issues, sir. So I am sorry to say that, sir.
Just tell me, no problem. Just
Yes,
tell
sir.
me, of the eligible people in your district, what percentage have been vaccinated?
Sir, above 65 years of that category, we have covered around 70% of our total population, sir.
With dose 1?
Yes, sir. Around say the 45 above 45 years. Just now we have started around 1 week back. We have started, sir. We are on the way. So it's around 12% of the total 45 above 45 years we are covered, sir. So healthcare workers and frontline workers above 90% we have covered, sir.
Is there any?
Why did you start
hesitation?
late in terms of?
Sir, there was some issue with the vaccine supply. So we were focusing on the above 60 years population. So only it became late, sir. That's what. Apart from that, there are no issues, sir.
Okay. Thank you.
Welcome, sir. Thank you, sir.
Thank you.